Welcome to UPLEVEL, Real Health, Real Talk with Dr. Jenna Blasi. I'm Dr. Jenna. I spent years crafting ways to help women thrive, and I want to help you do the same. On this podcast, we dive deep into health at every level, focusing on the mind, the body, and the spirit. This is where real conversations meet transformational wellness. We'll be talking about all the things that truly matter, from nutrition and fitness to lifestyle, mindset, and personal development. Plus, the real deal on managing stress and navigating menopause. So if you're ready to elevate your health journey with authentic, transformative insights, you're in the right place. Let's get started. Hello, and welcome back to UPLEVEL. I'm Dr. Jenna, and today we're going to continue talking about the heart and heart health. It is Heart Health Month, and so today I want to talk about breaking down cholesterol, some of the myths around cholesterol, and that heart health is not just about your cholesterol, but cholesterol still matters. So I know that a lot of people probably feel confused about the extreme messaging that's out there. I feel like when it comes to cholesterol, there's oversimplification, there's fear or dismissal. And so what I want to say is there's a lot of noise around heart health right now. Some voices say cholesterol is everything. Others say it doesn't matter at all. And the truth, especially for women, like most things, it lives in the middle. All right. Cholesterol does matter, but there's underlying reasons why our cholesterol gets out of balance that we can also address. So why does this matter? You might be thinking, why does this matter? Hopefully you're not, but you could be. Heart disease is the leading cause of death in women. Leading cause, more than cancer. Cardiovascular disease accounts for 1 in 3 deaths in women. So I'm not saying this to scare you, but this changes dramatically in midlife because our risk increases significantly after menopause due to loss of estrogen's protective effects, changes in lipid profiles, your LDL often rises, for example, increased visceral fat, insulin resistance, inflammation, etc. And yet, women are most likely to be underdiagnosed, be dismissed as low risk, and have heart disease that presents later, but more severely. So it's still under-recognized and under-discussed, which is why we're getting into it today, because heart disease is not just a men's issue. It is a women's health issue, and it is an important one. And so many of us worry about breast cancer and are just dealing with menopausal symptoms without really understanding how important our heart health is in this time of life. So looking at the things that change after menopause. Estrogen has protective effects on our blood vessels, on our lipids, on our insulin sensitivity. And after menopause, LDL often rises, HDL may drop, cardiometabolic risk accelerates, and also insulin resistance based on these things. So this is biology. It doesn't mean you have failed. I hear so many women say, this is the first time I've ever had high cholesterol, or this is the first time I have a high blood pressure came out of nowhere. And so this is why women often see what seems like sudden cholesterol changes in their 50s. I've experienced this myself. Now, I've talked about, I don't feel over the last year or so, I don't know if it's been that long, but roughly, let's just say a year, that I've been eating as healthy. I'm still moving my body. I'm still exercising pretty diligently, but my appetite control, ever since my estrogen dropped, it didn't happen around perimenopause or even early menopause. It was a few years after when suddenly my appetite control and food noise got louder. My appetite regulation became much more challenging. And so I was more prone to feeling like a foodie almost. Oh, that looks good. Oh, I want that. And so that's maybe a piece. But honestly, I don't think that's the only piece. Anyway, I recently did my labs for the first time in a while, and I have always had picture perfect lipid panel and blood sugar panel, and my blood sugar was a little bit high and my lipid panel was off. This is menopause. This is the effect it has on our body. It's also diet and stress and other factors for sure. So Cholesterol does matter. The research is really clear. And when people present research to the contrary, I really encourage you, learn how to critically appraise research. Learn how to look at research that you're being presented with and see how big was the study size. Is data being cherry picked? Find people who show you how to critically look at research and follow them because they're breaking down the research. And the nutrition experts, the PhDs in nutrition, the folks who've done a deep dive into the research, we know that cholesterol does matter. LDL is a risk marker. ApoB reflects your particle number and the amount of plaque-causing cholesterol, and these numbers matter, and the risk is cumulative over time. So it's not one lab. I don't want you to panic over one lab, but the longer LDL is elevated in your system, the higher the risk. And a lot of people say, no, we need cholesterol. It's important. Well, yeah, we need cholesterol, but in excess, there's a pretty direct and linear relationship to cardiovascular risk. So it is an important signal, but it's not the verdict. It's not the verdict. So I don't want you to go to the other extreme. Oh my gosh, my cholesterol is high. My heart health is doomed. First of all, you're always going to hear everyone's going to have that one story of the grandpa who, well, my grandpa, he smoked and he drank and he had high cholesterol and he lived till he was 95. I mean, is this what we want? Do we want to just do the anecdotal one-offs, or do we want to look at what the trends are? That said, you're not doomed, right? It's a multifactorial risk. So that's the reality, all right? Cholesterol, I want you to put it in context of a whole picture. Blood pressure, blood sugar and insulin resistance, inflammation, stress, sleep, lifestyle patterns over time. And then in the context of your own personal risk, your family history, etc. There are a lot of pieces that come into play. And especially if you're midlife and you're a midlife woman, your numbers might suddenly start to be an issue when they weren't before. Doesn't mean it's not changeable. I will be back here in a few months because I only did my labs recently, and I'm doing things. And I'm not going to get into it today, but I finally got myself on hormones, which if you want to know my personal story, I can spend an episode on it, but I haven't felt like I needed them. And then between the food noise and the cholesterol and the blood sugar and other factors, I just thought, you know what? It's time and it feels right. And I'm very excited for the support. Things have already started to shift for me. But also laying in these foundations is always key. And so the foundations of health that like we do with our program members, when I went through menopause and perimenopause, those foundations reset everything. They reset everything for me. And so I don't want you to ignore cholesterol, but I do want you to contextualize it. Okay. And this is where working with a provider that really listens to you and isn't fear-based, but is also aware that they don't underdiagnose you or downplay it. That surprises me as well. Physicians that downplay and then what? And then you have something that happens and you could have had something addressed. So this is understandable why women get confused and they get frustrated because many women eat well, they exercise, they take care of themselves, and yet labs worsen in midlife. I wish I had checked my labs. I don't really wish, but if I had checked my labs before I wasn't eating quite as well, again, I don't really think that was the primary driver. And probably what my not eating healthy looks like is still pretty darn healthy compared to most people. So I really do believe for me, it was those midlife changes. And I will, I'll fill you in later on how those shift as I actually dial in some of these pieces that I'm talking about a little deeper. So we should normalize that hormonal shifts reduce buffering. All right. Hormonal shifts are making a difference. Your stress load often increases in this time of life. You might be the sandwich generation. You might be caregiving. You might have recently lost a parent. Stress load increases. We often feel like we're doing things exactly the same, but when we really look into it, we're often not. We're different people dealing with different stressors. We might be moving our body less. Like I still exercise quite a bit, but I don't go into my brick and mortar office as often. When I went into my brick and mortar office, I was going up and down stairs. I'd forget. So I was on the third floor, and we have stairs in my house, but they're not as steep and not as big as at my office. And when I taught fitness classes outside of my house, instead of doing them in, I always ran or walked to my class and walked home. So there's a lot of shifts where you might be getting less movement than you realize. You're dealing with more stress than you realize. Your sleep is just a little more disturbed. All of these things add up. And then it feels like those old strategies, they stop working or they stop working as well. So please know that doing everything quote unquote right does not always protect you the way it once did. And that's not your fault. It's not your fault. Our calorie burn just from decrease in insulin is down, like our resting metabolic rate is down about 300 calories a day. 300 calories a day less that you're burning in postmenopause. That's a significant difference, right? People love those little 100-calorie, pack of whatever. That's 3 of those. So let's look at what actually supports heart health. I'm not going to give you protocols today. I'm not actually going to get into supplements. I want to talk principles, higher level. In some of my other podcasts, I go into details on diet and stress management. You can dive into those. And as far as supplements, yes, there's some supplements out there that will help. There's some supplements, but that's where you should be ideally working with someone and looking at what is the research and what is the efficacy of certain protocols for blood sugar alone, or high cholesterol alone, or the combination of insulin resistance and cholesterol, and how is your sleep? There's so many factors. So high level, nutrition quality and consistency matter. They matter, okay? Nutrition quality and consistency matter. And I do have to tangent here briefly. I brought this up last time. What we're being told, look, if we go back to pre-pyramid, food pyramid, and look at the My Plate, that was good. My Plate was good. We had that for years. We didn't actually need to address the food pyramid because we weren't using it anymore. We were using the My Plate, and that's pretty balanced. The food pyramid visually shows that you should be having a lot of saturated fat at the top, and the research does not support that. I know the carnivore folks out there are not going to like to hear this. The research doesn't support it. There's a very direct link with higher saturated fat and cardiovascular risk, high LDL, as well as dementia, which I talk about in my brain episode. But I'm not going to get into that. I just want you to know that even though visually it's showing meat and butter and whatnot at the top, if you actually look at the guidelines, like the same guidelines for that pyramid, it tells you to keep your saturated fat under 10 or 11% of your calories. And if you add like steak with a little bit of butter, you probably exceeded that. So there's a lot of contradictory information, and that just leads to more confusion. And I'm sorry that there is so much lack of clarity. So find what works for you, but also understand the data and the research, and ideally, work with someone that can help you figure out what is the ideal diet where you feel really good and your labs look good. So nutrition quality and consistency matter. Fiber matters, makes a difference. It's actually been really well studied. Even 1 tablespoon of fiber a day can lower your LDL. Strength training and movement. Cardiovascular, like cardio, is still good for your heart. Strength training is important. So like all movement is going to be heart healthy, but the recommendations are a mix of both strength training and cardio training. Your stress load and your recovery matter. You've got to recover, and addressing stress. And when we look at medication, what I want to say about meds, and I'm not going to get into that today either, I used to be very I really did. I used to be very anti-med. And now when I'm looking at that, I really am trying to get out of my dogma and look at what the research says. Medication absolutely can be an effective tool. A lot of different medication possibilities. There's a lot of misinformation about various medications for cholesterol and other things. Medication is a tool, not a failure. And I'll probably do an episode in the near future on GLP-1s, because I was also very judgmental of those when they first came out. And the more I've dived into the research and not only seen clinically what they're doing for people, but what the research shows in terms of risk and benefit. And they're an incredibly helpful tool. But again, like any tool, the fact that you need the tool does not mean you failed. Okay. The fact that you need a medication or GLP-1 even does not mean you failed. It could really change a lot of things for you, just like hormone therapy can change a lot of things. GLP-1s are life-changing for people with the food noise aspect, etc. But let's also address the underlying. Someone going on a GLP-1, if they don't do it right and they don't strength train and they don't address their habits and eat healthy, they will still have issues. Agreed? And so, and if they ever want to come off, if they haven't addressed these underlying things, those things are not gone. So it's the same with the medication. If you go on a medication for your cholesterol, let's still address diet and lifestyle and stress and sleep and hormones and all those other pieces that are driving the issue that's showing up on labs or showing up as a symptom. All right. So prevention isn't about perfection. None of this is about perfection ever, but it is about reducing your total burden over time. And I would also add that your own preferences, anxieties, family history, risk benefit ratio, like that all matters. And one of the things I'm really, really big on is shared decision making and informed consent. Because what I see so often out there in the medical community is they just throw meds at you and tell you surgeries. So they either are like, oh, there's nothing we can do, or they look at your labs and they're like, you're normal and you know something's not right, or they're very, very alarmist. I'm just throwing out a few of the things that I see commonly, but I was just talking to a woman today whose practitioner, she's going through perimenopause. She's having so many perimenopausal symptoms, and her practitioner said, we can't treat your hormones until you're 1 year without a period. So basically she's telling this woman, we can't treat your hormones until you're menopausal, because the definition of menopause is 1 year without your period. That is 100% not true. And it's actually really not good advice, because it is the perfect time to address all this. If you're perimenopausal, the greatest bone loss occurs in the 2 years before and after menopause. There's so much support that can be done. And it's not just hormone therapy. It's all of the support that I'm talking about. But back to what I was saying is this is where that shared decision-making and informed consent. If I'm a practitioner and I just don't know, then I can say I'm not comfortable to do this, right? Like this is another one I hear often. And again, I'm tangenting a little bit on hormone therapy, but there's so much misinformation. If you want to know more, you can listen to my podcast just on hormone therapy. But so many practitioners say, oh, you have a family history of breast cancer, so you can't have hormone therapy. That's also not true. And it's not a contraindication. But what matters is being educated enough to talk with you as an individual, explain the risks, explain the benefits, and your family history and your individual personal history. And then what is your preference? Because if you have anxiety based on misinformation, I think it's our duty as practitioners to clear up that misinformation. But you may still not want to, for example, take hormones. That's okay. That's your personal choice. But let's make our choices from an informed place, an actual informed place of what is truth. And what I see is so many practitioners, because we know the stats on conventional practitioners, they're not trained in menopause. They don't know how to treat menopausal women, menopausal symptoms. And so rather than just saying that, they repeat misinformation rather than saying, I'm not comfortable prescribing hormones for you with your history, but I'm not really trained in it. So maybe go to somebody who is. I'm never afraid to tell people I don't know. It's like I've been doing a dive into into peptides recently, as I mentioned in my previous podcast. They're not, FDA approved. The research is still emerging. I know anecdotally, lots of people who think they've made a big difference. The GLP-1s are a peptide, but the ones that people are using, most of the ones people are using, are FDA approved and have been studied, and we know, the risk benefits, et cetera. But I like to always be learning. And so I will tell people, look, I'm not anti you doing this. I just want you to know, here's where the research lies. Here's where my comfort lies. Here's what I'm willing to do and not do. And if you are interested in where the research is at now versus where it may be in 5 years or 10 years, that's a personal preference to some extent. All right. So these are the conversations I like to have with people. And if I recommend something that the research doesn't support, I at least let them know that. I'm like, hey, I'm a huge fan of this. We don't have any research on it. I've seen it clinically. We don't have the research, and I will let people know. So whoever you're working with, please be a part of the conversation. Make sure they're doing informed consent with you. So often I hear, and I've experienced this myself medically, Nobody even reviews the risks. So there's the other end of that. So I'm talking about people that are saying it's not safe incorrectly, but the other end is people just giving you stuff and not telling you what the risks are, not telling you that it's not actually studied or approved. There's two ends of that pendulum swing. So I don't think either is right. Because again, informed consent, informed of all sides, pros and cons, risks and benefits, and then shared decision making based on you as an individual, your personal choices, preferences, etc. Okay? So understanding risk is agency. It's not alarm. I know some people, they don't want to go to conventional medical doctors. It's a very fear-driven system, right? I know there's wonderful individuals, but as a system, it's very fear-driven. But I always tell people, information is power. You don't have to accept the treatments. You don't have to take the pills or do the procedures, but let's know what's going on. Understanding what's going on with ourselves and understanding risk is agency. Doesn't have to be an alarm. And heart health is a long game. It's a long game. And women deserve nuanced, honest information. And that's why I do this. Because there's a lot of misinformation. Information evolves. It's hard to sift through all the noise, and you deserve nuanced, honest information. I'm always willing to have a conversation with my patients, my program members, about what's going to serve them best. And not everything is black and white. Even like hormone therapy, we talk about the window of opportunity and 10 years and under 60. Lots of women over 60, even 70 years old are going on hormones. But let's have a nuanced, honest conversation that checks all those boxes. All right. So heart health is not about one number. It's not about one decision. It is like everything. I mean, I would say what I'm about to say applies to everything. It's about staying engaged with your body and making informed choices over time. I'm thinking of hormone therapy again. A lot of doctors will say, oh, you're too old. You've been on it too long. And they'll just take you off it for no reason based on arbitrary cutoff of your age, which is actually not research-based, or how long you've been on it. Neither of those things. If anyone ever tries to take you off your hormones based on your age or how long you've been on it, that's not research-based. What is research-based is having informed conversations over time. So as you get older, how is your risk benefit changing? And having that conversation for you with your personal history, your family history, your personal preferences, your quality of life, how you're feeling, all of those pieces. All right. Does it make sense? And I'll just use the hormone example. Does it make sense for you to stay on hormones? Or does it make sense to try coming off it? And so this is true of any medication, anything that's not like an overall, like ideally with lifestyle, we're staying on it forever. When we look at the blue zones, they're not like, oh, I'm 80. I think I'll stop moving my body. Oh, I'm 80. I think I'll stop, I'm 90. I think I'll stop eating well. Like, no, it's the long game. And lifestyle and diet and movement and stress management and joy and relationships and love. Those are the long game. All right. And I'd add mindset into that. The medications, the tools, the supplements, those can shift. And so have those conversations. So if you're listening and you're wondering what to do with this, what I would say is paying attention to patterns matters, not panicking over one number, but working with someone you trust, working with someone that can look at you as a whole person and have this shared decision-making conversations and focus on habits you can sustain long-term. So if you can't sustain it, what's the point? So focus on habits you can sustain long-term and let's have amazing heart health. And I will just do a little plug for my episode on joy last year. I think it was in December sometime. Because joy is super important for your heart health as well. So let's remember that too. All right. Thank you all so much for joining me, and I will see you next time. Thank you for joining me on this episode of UPLEVEL, Real Health, Real Talk. I hope today's conversation inspired you to take the next step in your health journey, one that nourishes not just your body, but your mind and spirit as well. Don't forget to subscribe so you never miss an episode. And if you found value in today's episode, please leave a review. Until next time, keep learning, keep growing, and keep thriving. And remember, true wellness is a journey, and you are on the right path.